Welcome to Derwent Valley Medical Practice.
Hello, good morning. Come in and have a seat. My name's Corinne.
What a lovely holiday. You enjoyed yourself? Oh, it's been fantastic, Jen, absolutely fantastic. We're back to work tomorrow. That reminds me, we need a new GP. And really strangely, all these GPs go to places like this and Australia and New Zealand. And Derby's such a lovely place. Why are they not coming? We need somebody who wants to work in Derby. Derby's a great place to work in the centre of England. It's got the world's oldest factory, the Silk Mill, which is a World Heritage Site. Even Bonnie Prince Charlie came to visit.
So let's talk a little bit about the practice. We're situated in the centre of Derby. We work from 2 purpose-built surgeries. These are leased premises, and so there is no buy-in requirement for any incoming partner. The practice has been in existence since the advent of the NHS. We're in a period of refurbishment and transition, and in particular our Spondon surgery is currently being brought up to CQC standards. We have excellent minor operating facilities and a dedicated room for our GP registrars and students, of whom we have many.
The practice in the NHS can feel like a ship in a storm. You can feel buffeted around by the huge waves. If you work as a team, you can make the boat steady. When things calm down, you can start to plan the future more carefully. Remember, it's all for one and one for all. In our team training afternoons, we problem solve and have plenty of light bulb moments.
Had a good day. Yeah, really nice. Good. Been busy. Yeah, you ready to start? Yeah. What time are you finishing? 1:30.
Hi, my name's Natalie. I've worked at Derwent Valley Medical Practice for the past 18 months and I really enjoy being part of the team.
Hi, I'm Karen Hibbs. I'm one of the practice nurses at Derwent Valley Medical Practice. I've got a particular interest in diabetes, but otherwise I just do everything that I'm asked.
Hi, my name's Susan. I'm one of the practice secretaries in a team of 3. I've been here almost a year. I'm really enjoying the job.
Hello, my name's Corinne Waters. I'm a practice nurse here and I've been here for nearly a year. I thoroughly enjoy my role and all the patients that I've met over the past year. I've done lots of training courses and learning so much every day. It's been fantastic.
We do have a very supportive and good team, especially the clinical team, and this is, I think, is the most important thing in our daily life at the moment.
Oh, very good team. There is very good teamwork amongst the team. It does have to change depending on the workload, if people are sick or holidays, and then your specific role might vary a bit that day. People do multitask and do help each other, which is nice.
Hi, my name is Sam Walker. I'm a practice nurse at Derwent Valley Medical Practice. We've got an excellent team of staff here. I've been working at the practice for about 14.5 years now. The job's very varied, no day's the same, but as I say, we're all a good team.
One of the really good things about the practice, Jen, is that we're always thinking about patient safety. Just think of all those audits that we do. Well, the audits are fantastic. We put so much effort into all the audits that we do for patient safety. We do, and also, I think it's brilliant when we meet together on those Wednesday afternoons, you close the surgery and we do teaching together. The teamwork's fantastic. We have such a lot of loyal staff, we do.
Fantastic. So how do you feel about raising concerns for patient safety in the practice?
Well, I think that's very important, and I don't think anyone would have any qualms about coming to either me or the senior receptionist or even going straight to management.
There's so much innovation in Derby. What about the Merlin engines that won the Battle of Britain? It's the Rolls-Royce engines that take us on our holidays. And there's innovation in the practice as well, having one of the first prescribing pharmacists in the country, as well as our CCG care coordinator.
My name's Kate Perkis. I'm the care coordinator based at Derwent Valley Medical Practice. It's a great practice to be placed at, and my role is to coordinate support for patients over the age of 18, vulnerable adults, at risk of hospital admission, and try and bring together different support services.
Hi, I'm Jackie Buck. I'm a mental health nurse, currently working as an ENP in Derwent Valley Medical Practice. My role within the surgery is to review any new acute mental health patients that present. I think that Derwent Valley Medical Practice have been very forward-thinking about looking at employing a mental health nurse within the surgery. They've been able to change the service needs to make sure that the patients' needs are met. and hopefully this is a new way of working within mental health and also helping us bridge that gap between physical health and mental health services.
Hi there, I'm John Frayne. I'm the Senior Partner at Derwent Valley Medical Practice. I hope you're enjoying our film. As you can see, it's a good place to work and we have a great team of very conscientious people dedicated to giving good patient care. We're willing to consider applications for salaried or partnered GPs, so please keep watching, and at the end of the film we'll give you the contact details to make an application.
Okay, what do you think we need in a practice, Anna? Do you think we need a salary GP or a partner? Salary GP would be fine, but I think there's loads of advantages to being a partner. Over to Dr. Lucas.
To be able to make changes to practice and to make decisions all together with partners that are trying to improve the mainstream of work, trying to make some organizational changes in the practice to make our practice to work better, smoother.
There's a Bluebell Wood 5 minutes from our Spondon surgery. The Peak District is an undiscovered gem in Britain. You can relax and unwind and take in the countryside. Chatsworth is one of the most beautiful country houses in Britain. You can even join us on our holidays and travel from East Midlands Airport with all close motorways nearby.
So, my name's Becky, I'm the advanced nurse practitioner. I've been working in about 7 months. I've found it really rewarding, I've settled in nicely. I really enjoy my job, I find it very varied. I've got a lot of support within the practice. I have a weekly mentor meeting with Dr. Frayne, which I find really helpful. We also have meetings with the nurses regular, so we keep ourselves up to date with training, etc. As a practice, I think we're very welcoming. We've got nurses that have been here for many years, and I think that shows what kind of supportive practice we are. And we would love to receive new staff and would support anybody coming into the practice.
What about the registrars and the training in practice? We have one of the highest numbers of medical students in the whole area. This is a future generation of doctors and our registrars as a training practice. The feedback's been fantastic.
We teach medical students at the practice and have done so for about the last 15 years. We have large numbers of students, and we're a training practice, so we train GP registrars. This is a really exciting and enjoyable part of working in the practice.
I've really enjoyed it. I think I've learnt a lot, and I've always found everyone very approachable, and all the staff have been extremely helpful. I think it's been a very, very nice experience. The patients have actually been lovely.
We have great relationships with the practices and other external organisations.
So Derwent Valley Medical Practice is one of 5 practices which is in a place. We originally started with 2 hubs, and then in April this year a third hub was authorised by the CCG, and we, along with another practice, are sharing that week, and we do the weekends here at our Spondon Brent surgery, and so far it has been maximum filled with appointments. So obviously the location and the site is beneficial to the patients who want to come.
One of the great things about the practice is how well the partners get on together, and that isn't always the case. We had a fantastic time of summer 2017 in Liverpool, and the fact we work well together means that we can sometimes have difficult conversations with the way the NHS is at the moment, but we always get on well. So what are we looking for?
A person who is hardworking, who likes challenges, person who knows what he or she wants to do in the future.
We would love to be joined by an enthusiastic doctor who values working in a team, working in the community, and having the chance to both teach and train, and also getting to know patients over many years.
Despite difficulties in the NHS, general practice is still a great career, and Derwent Valley Medical Practice is a wonderful place to work. Come and ride the waves with us at Derwent Valley Medical Practice.